Hello, good morning. My name is Dr. Moise. I'm your physician today. So before we proceed to the subjective examination, I need to know your personal details first. So may I know what is your name?
Max Loon.
Max Loh,
60 years old.
60. What is your address?
Lenina Street.
The occupation?
I'm a welder.
Welder. What is your marital status and are you married?
Yes, I'm married.
Okay, so admission is today, right?
Today is my first day.
Okay. Okay, Max. For subjective examination, I need to ask you a few questions. What brings you here and what are your complaints?
I have very intense pain at my left arm, and I don't know what to do to relieve this pain.
Do you have anything more to add to your
I also have numbness and coolness at my finger.
numbness and coldness at your easily get bruised? Any gum bleeding? When this pain started?
This pain started about 2 hours ago, and the pain is getting stronger and stronger, so I decided to call the ambulance and come to the hospital.
Your medical history? Any allergy?
No.
Blood transfusion?
Yes, but it's very many years ago.
Do you smoke, Max Loan?
Yes, of course, I smoke one packet for 2 days.
Okay. Do you drink alcohol?
Yes, 3 times a week.
Is there any family member with medical history?
No.
Okay. Do you have diabetes mellitus?
No.
Been in operation theater?
No.
Okay. Have myocardial infarction?
No.
Do you have tuberculosis?
No.
Stroke?
No.
You've been diagnosed with cardiac arrhythmia?
Yeah, I have cardiac arrhythmia, yeah.
Okay. You have rheumatic disease?
Also, yes.
See, okay. How about mitral stenosis? Do you have it?
Yes.
Take any medications? Thank you, Maxlon. Okay, Maxlon. I'm going to do objective examination for you. So, for general condition, I will give you satisfactory. And may I take your glasses, please? So, for Glasgow Goma scale, it is 15 points. And then, for the look on the face, is older than his actual age. And for your posture, from the moment you came, I can say that you're on dependent posture because you're supporting other hand because your left hand is in pain, right? Okay. And for your BMI overweight, because your weight is 85 kilogram and your height is 170 centimeter. For constitution is normal, and for nutrition status, you're well nourished and symmetrical state of development. And for your skin, so there's a pale skin on your left arm, absence of hemorrhage, no scars, no pigmentation, no edema at upper and lower part of your body. And for your temperature, I already checked it and you got 36.8, which is normal. But there's a coldness on your left arm, but on your right arm is normal. Okay. Okay, Max Loon. I'm going to do objective examination. And for the first part is respiratory system. And then I can see that from the inspection, you have a normal form of chest and no deformity of chest wall. And from your breathing, the breathing is normal. And then your respiratory rate is 26 per minute. Now I'm going to do auscultation. Okay. Can you turn your back, please? Okay. From the auscultation, it is normal. So for the conclusion of the respiratory system, you can say that from the inspection, it's a normal form of chest, no deformities of chest wall. His respiratory rate is 26 per minute with a normal rhythm. That's all. Okay, Mark Sloan, I'm going to do objective examination for your cardiovascular system, okay? Now it's for the auscultation. Okay, Mark Sloan, I'm going to take your blood pressure, okay? Okay, Mark Sloan, you are having hypertension, 140/90, okay? Okay, Mark Sloan, I'm going to do your pulse rate for both hands, okay?
In conclusion, for the cardiovascular system, his blood pressure is hypertension, which is 140/90. Meanwhile, his pulse rate for his left arm.
Now I'm going to do GIT inspection towards my patient, which is Mark Sloan. So for this first part, I'm going to do palpation. This is light palpation. And now I'm going to do for the deep palpation. Do you feel any pain, Mark Sloan? No. And now I'm going to do ballot the kidney. Okay. For the second part, which is percussion. And last for the auscultation part. Sloan, thank you. You may get there right now.
For the GIT inspection, and in conclusion, I can say that the patient has normal overlying skin, no abdominal distension, abdomen was moving with respiration. During auscultation, there was a bowel sound, soft, non-tender, palpable mass, and no megaly. That's all.
After gather all the information needed, we can make a conclusion on the hemostatic system. In this case, a patient is having rheumatic disease, which cause damage on the mitral valve and cause stenosis. The endothelium that damage will activate the platelet and the coagulation will happen. This situation will activate the formation of the thrombi, which is the blood clot, especially at the left atrium. From the virtuous triad, we can conclude that the blood hypercoagulability will be present. Also, there will be the damage of the vessel wall, and there will be a change in the blood flow. The change in the blood flow is not slow, as the damage happened in heart, where there will be a fast motion of blood, especially at the stenosis area. From virtuous triad, 2 out of 3 triad are affected. We can make a conclusion that there will be a high activity of hemostatic system that can cause a thromboembolitic complication to the patient. We also can conclude the situation by perform blood tests. We can see that there is a low bleeding time, clotting time, prothrombin time, and activated partial thromboplastin time together with international normalized ratio of the patient. This shows there will be a hypercoagulability present in the patient. There will be a high of the platelet count because the platelet is accumulate in the site of the damage in a high amount. Cholesterol level, glucose level for diabetes, troponin T and I, activity of creatine phosphokinase, AST and ALT, erythrocyte sedimentation rate, and leukocytosis will also be high. As a final diagnosis, we can explain to the patient that he have a thromboembolism at his left brachial artery. This is due to the rheumatic disease. It results in scarring of heart valves and cause damage at the endothelium site. This damage can lead to formation of the blood clot in the left atrium. One of these clot move away and flow to the brachial artery, which then form the blockage of the blood flow. And this is why he will feel numbness and coldness at his left arm, as he does not have sufficient blood supply at the site as it has been blocked. As for the treatment, we will advise patient to lose his weight and have a healthy diet together with do a physical exercise. He also will have smoking cessation. The medicine that we will prescribe to the patient is vasodilator. We will give the patient 1 tablet of verapamil, 180 mg, once a day before bed at night. This is to dilate the vessel and prevent the clotting of the blood to form. Other medicine that we will give to the patient is antiplatelet drug, which is aspirin. This is to prevent the formation of the new blood clot in the vessels. The patient will prescribe aspirin 160 mg, 1 tablet, once a day after breakfast. If the medical therapy fails, the surgical treatment will be needed to prevent any serious complication.